Join us now for Health for Life, brought to you by Hamilton Healthcare System.
Today we're talking with Dr. Lisa Duhaime of Peeples Cancer Institute in Dalton. Thank you for joining us, Dr. Duhaime.
I'm glad to be here.
Dr. Duhaime is a board-certified medical oncologist at Peeples Cancer Institute, located at 1215 Memorial Drive on the campus of Hamilton Medical Center. She specializes in adult cancer and hematology disorders. She completed her internal medicine residency at Henry Ford Hospital in Detroit, Michigan, and her medical oncology hematology fellowship training at the H. Lee Moffitt Cancer Center at the University of South Florida in Tampa. Dr. Duhaime, can you tell us about Peeples Cancer Institute?
Yes, I'd be happy to. It's on the campus of Hamilton Medical Center on Memorial Drive. Peeples Cancer Institute houses both diagnostic and treatment services in one convenient location. This allows for Hamilton's expert team of board-certified medical oncologists, radiation oncologists, radiologists, surgeons, and clinical support staff to work collaboratively to provide state-of-the-art care in a healing and nurturing environment. Peeples Cancer Institute is transforming cancer care in our region.
Let's talk about cancer. Well, what exactly causes cancer?
Cancer is a broad term. Normally, everyone starts with normal functioning cells, and cancer doesn't happen overnight. It usually happens as a cell progresses into cancer, it develops mutations, and one mutation in and of itself won't develop cancer. You usually have this slow progression, and that's why cancer doesn't happen one day. It's a slow progression over a long period of time.
How does it happen to spread in the body?
Once cancer cells get big enough, as in once you have several hundred or thousand cancer cells, it can eventually invade into a blood vessel or a lymph vessel, and that's basically your body's transport system through the entire body. And that's how it spreads other places.
Are there natural, holistic ways to lower our risk of getting cancer?
Yes, there are 10 holistic or natural ways that we can all lower our risk. They include, number 1, don't smoke. Number 2, eat a healthy diet. Number 3, be active. Number 4, maintain a healthy weight. Number 5, avoid unhealthy exposure to sun and tanning beds. Number 6, avoid risky behaviors. Number 7, have a primary care provider. If you don't have a primary provider, visit hamiltonhealth.com/primary for a list of providers. Number 8, get an annual physical. Number 9, be screened for cancers as recommended by your primary care provider. And number 10, explore your family health history and share this with your primary provider.
Okay, so let's take these one at a time. When you say don't smoke, I assume that means to not use any type of tobacco product, including vaping and smokeless tobacco, right?
Absolutely. The obvious one is smoking cigarettes or cigars, anything that has direct smoke into your system, such as your lungs. But tobacco products such as dip can cause head and neck cancer, cancer in your mouth, and we do not know the risk of vaping or smokeless tobacco at this point. But my concern is 10, 15 years from now, we're going to have this mass amount of lung cancers caused by all the chemicals in the vaping products, because those are going straight into the lungs.
You also mentioned that our diets are really important. What types of food should we eat, and which ones should we probably avoid?
Which type of foods we should eat are easy. Fresh fruits and vegetables. Limit your amount of meat to 3 to 4 times a week. The types of foods you shouldn't eat is a more general type of question that I would say most importantly, and what's obvious that we're seeing, is the amount of preservatives and chemicals that are placed in the American diet, and just the quantity of food that Americans eat are our biggest downfall. And it's proven in studies that have shown things such as the number 1 continent that has the lowest colon cancer risk is Africa, whereas America, or North America, has the highest colon cancer risk. And I believe that's because in Africa, they eat all fiber and they're a low-fat type of diet, whereas in America, we have an all-fat diet, and most people do not even get in the FDA recommendation for the amount of fiber in a day they should get. And we know that high fiber diets decrease colon cancer risk.
The number 3 way to lower our risk of getting cancer, as you were saying, is to be active. So what kinds of activities should we be doing?
Anything that gets you out of the chair.
Okay.
There are studies in almost every type of cancer that shows that physical activity is directly related to better outcomes, not only in prevention of cancer, but during cancer treatment. We know that the more physically active people are, the less likely they are to develop cancer. And I think it's directly associated with the next bullet point that I had, maintaining a healthy weight. The more active people are, the less obese they tend to be. And we know that obesity is directly associated with increased cancer risk.
So that ties into why keeping a healthy weight is very important when it comes to cancer prevention?
Absolutely. We know that smoking and drinking alcohol are the two highest risk factors for cancer, but we also now in the United States know that our diet or weight has become the third highest risk associated with cancer.
And you also mentioned sun exposure. Why is this so important to keep in mind when reducing our risk for skin cancer?
Because we know that the amount of sun exposure people get, especially as children, is directly proportional to their risk of developing skin cancers, especially melanoma, which is the most dangerous and most likely to lead to death.
Could you tell us more about how lowering our risk of getting cancer is to avoid risky behaviors?
So that actually goes into all of the vices we've talked about before. Don't smoke, don't drink, and cervical cancer is directly related to sexual activity and the HPV virus, which is spread through sexual activity. As well, now head and neck cancers have been associated with this as well.
Why do you think it would be so important to prevent cancer to have a primary care provider?
Because primary care providers will help set you up with your regular cancer screening. And if you notice something strange going on in your body, you're more likely to address it if you have a primary care physician and not wait until it's to a point that you present yourself at the emergency room.
Why is getting an annual physical so important?
Just seeing your doctor once a year will help them notice any changes possibly in your skin, as well as a drastic weight change, something that you may not think is important, but all of a sudden it is, and you didn't even know that this was something that you should be bringing to their attention. As well, primary care physicians will set you up with your annual mammograms, make sure that you're up to date on your screening colonoscopies, also make sure that you're up to date on prostate exams if they feel that's necessary. And now with smokers, they are recommending patients who have a long-standing smoking history should have yearly low-dose CT screenings.
Number 10 on the list of ways to reduce our risk of cancer is to explore our family health history. Could you tell us more about how exploring our history, genetics and stuff like that, could also help us understand this?
So patients who have a strong family history of cancer should definitely bring this up to their physicians, because nowadays we have lots of tests and we are discovering more and more genetic mutations that people are born with that increase risk of certain cancers. And there's not just one gene that's associated with all the cancers. There's actually several genes that can be tested for based on what type of cancer is strong in your family.
Dr. Duhaime, it's been so great having you on our show. We've learned so much.
Thanks so much for having me. I've enjoyed being here.
Yeah, thank you. We appreciate it. And for more information or an appointment at Peeples Cancer Institute, call 844-PCI-HOPE. To learn more about Peeples Cancer Institute, visit hamiltonhealth.com/cancer.
This program in no way seeks to diagnose or treat illness or to replace professional medical care. Please see your healthcare provider if you have a health problem. Thank you for listening to Health for Life, a presentation of Hamilton Healthcare System.